Fat transfers work best when the individual is prepared properly. And that becomes even more important when we're combining explant surgery, which itself, especially my patients, they've come in with usually a fair amount of inflammation that's chronic. And we don't want them to have anything but the smoothest possible course. So some will say that you should not do a fat transfer at the time of explant, either due to toxicity concerns or the tissues themselves. Um, but in general, I think of it as, working with the patients to help with their inflammation and then properly prepare them. And if we can't get the patient prepared, then they're not going to be a candidate, and we can do it as a delayed procedure. But we want to, one, decrease their inflammation, and then when we transfer, have enough volume to transfer, place it in the correct space beneath the skin, above the breast, and then do it in a really clear and concise manner. And if you approach the cases like that, um, I think that puts the best interests of the patients at hand. Um, we don't approach explant surgery as just a explant procedure with no optimization or preparation for the patients. We actually are careful in our workup. Many patients come to me. The patient who I took care of this morning, who had a simultaneous fat transfer and explant, actually came in from Canada. And they came in specifically for our programming that helps reduce inflammation, really get their immune system prepared for what can be not a long or difficult case, but still each case is stressful to the patients. And I really, if I can get a patient properly prepared, I prefer to do simultaneous fat transfers. They make a lot more sense to me in the carefully selected patient. So I want to do it to help preserve breast shape and volume, really help reduce the big change that you see visually by explanting, and then potentially avoid a second surgery. It can be very, very helpful emotionally for a patient to have volume restored at the same time naturally. But the selection of the patient is critical. You know, if anybody has heard me discuss, how I think about this, the number one thing in any recovery process is sleep.